Hi everyone, welcome back. So today I am going to be talking about wrist pain and carpal tunnel syndrome, which I know is sort of quite common. I'll be talking about what causes it, who is most at risk of getting carpal tunnel syndrome, and basically what you can do about it if you get it. Wrist pain generally can, occur usually either due to lifting weights, whether that be sort of in a gym environment or, maybe through work. And it can also be a work-related injury. Certainly, I developed quite bad wrist tendinitis just due to my job and that constant applying a lot of pressure, when doing the sports therapy. And so this basically happens because it's an overuse injury, and as I say, you've got that repetitive compression of those, you've got lots of really small wrist bones that maybe are being forced into an unnatural position, which, if the muscles tighten up, you're going to get compression of nerves and all sorts, and inflammation is going to, happen at some point. In terms of lifting weights at the gym, I say all the time, incorrect technique and positioning, will put the wrists under a huge amount of stress, particularly in exercises like bench press, or any kind of sort of weight lifts, deadlifts, also things like high planks and push-ups. But any exercise really where you get overloading of the wrist with increased weight while in, extension, that's where you're gonna get, irritation on that wrist joint. You may also find that the wrists possibly will overcompensate for any weakness around the shoulder area, because if the shoulder's weak, then you're going to find that your forearm muscles are doing a lot more of the work, and that's then going to have a knock-on effect on the wrists. So, quite often if clients come in and they've got some form of shoulder weakness, it's a good idea to also cover those forearm muscles. Wrist pain from weightlifting is, more often due to strained tendons or ligaments. If you can change, to a lower impact workout as soon as you get that mild pain, potentially that can be enough, to prevent further damage. But obviously a lot of people that, go to the gym regularly have a very kind of competitive nature, and they sort of tend to push through the pain because they think, that will kind of work in their favour, but it doesn't always. So sometimes it's better just to back off a bit, to prevent you from having further injury. Outside of the gym though, contact sports again, anything where you're potentially going to fall onto an outstretched arm, wrist pain is going to be more likely, also due to fractures, but whatever the cause, if the pain exceeds 2 weeks or it becomes severe, if you end up with a lot of swelling in the wrist, then you really need to seek, medical advice. So the most common wrist injury that we're going to talk about is carpal tunnel syndrome. This is often work-related, but it is becoming more common in weightlifters. And research has also shown that genetics certainly have a role in developing carpal tunnel syndrome. So, what is carpal tunnel? Basically, it is where the connective tissue in the wrist becomes inflamed. And as we know, you've got that fascia and connective, which is like a tough fibrous connective tissue. It surrounds all the muscles and the nerves in the body. So that becomes inflamed and then compresses on the median nerve, which runs down the wrist here. That then interferes with sensory nerve transmission from the hand to the central nervous system. So if left untreated, this nerve compression will then cause that nerve to become locked within the wrist, because you'll just basically get a load of scarring build up. And all this is going to do is basically give you very, limited range of movement in those wrists. You'll also find fluid pressure within the wrist will increase, and this is because you'll get a thickening of the synovial tissue in that carpal tunnel. So again, that's going to, add to that compression. So who is generally at risk of developing carpal tunnel? Well, as we've said, research has shown that there is a genetic factor. So obviously if you've got, sort of immediate relatives who have had this issue, then you're probably more at risk. It does seem to affect women between the ages of 40 and 60 more than anyone else. Anyone, as I say, I had it with my work. If you've got excessive and repetitive use of the hands for work, so this could also include people like, sculptors, surgeons, hairdressers, people who, sit at a computer all day. People also who, work with vibrating tools. So maybe people who, do the road works, using road drills. But also you tend to see an increased risk in pregnancy, diabetics, obese clients, people going through the menopause, or those that have arthritis or sort of history of wrist fractures and dislocations, and potentially even with shoulder dislocations, because, as I say, if there's a weakness in the shoulder, the forearms are then going to work that bit harder, and that's going to put extra, strain on the wrist. So once you develop carpal tunnel, you are going to experience, obviously, pain. Now, this tends to be more on the thumb side of the hand and the wrist, so sort of coming down this side. The pain tends to be increased at night, and may even become a burning sensation, again around the thumb, the index and the middle finger, or even numbness and tingling, again particularly on that thumb side, and that's where that medial nerve is being compressed. The pain may also extend up the arm. You will experience reduced sort of range of motion, reduced manual dexterity, grip strength, and may, find that you have problems performing repetitive movements. So again, if you're someone, who's working at a computer all day, or, a surgeon, you may have a lot of trouble. So in chronic cases, it's also possible, I wouldn't say it's common, but it's possible that these muscles just below the thumb here may also atrophy. Because again, if you've got reduced range of movement and it's painful, you're not using those muscles, the muscles will just become weak and kind of wither away. So important to get treatment, as soon as possible. So in terms of treatment, certainly, standard one, stop whatever exercises or movements, are causing pain, or anything that involves extension of that wrist, really just in order to prevent further inflammation. Apply ice daily. Again, that's just to help reduce any inflammation that's there. Wear a splint. You can get some really good splints on Amazon that are not expensive, which will just keep the wrist in a neutral position and reduce pressure on the joint. Now, I will say you shouldn't be wearing any kind of splint, 24 hours a day, because again, it can actually cause further weakness in the muscles. For me, I found that when I had bilateral tendinitis in my wrists, and I found that by wearing splints at night, it just really gave the joints enough of a rest to mean that I could then get back to work the next day. They're really designed to just reduce the pressure on the joint. You can, again, massage. You can do it yourself or go for a massage, really to these forearm muscles to ease any tightness that may also compress on the nerve. Cortisone injections are a possibility, but again, they are short term, and I'd say that's sort of more if you're having real severe problems. You can do stretching exercises, but once the inflammation has subsided, and if you are going to go back into the gym or sports, just maybe a bit of strapping to the wrist is a good idea, to help just support the joint and to maintain a neutral wrist position. For things like push-ups, you can use the knuckles to push up on, so that you can keep the wrists straight, and that will just, take the stress off that wrist joint. If you're a weightlifter, try wearing well padded, lifting gloves, and also placing the hands in warm water, before you go into the gym can also just help to relax those muscles a bit. But, again, in rare cases, and it is rare cases, surgery is possible to relieve the pressure on the nerve. But, as with most things, if you get in there and treat it early, it doesn't usually come to that. So now there are, you can do exercises to strengthen the wrists. I'd say focus on sort of flexion and extension, pronation and supination. There is something called therapy, which a lot of occupational therapists use. Certainly my daughter used it. She had cerebral palsy, and it's good for just strengthening those hand muscles. It's basically like Play-Doh, and you just knead it, and it just helps strengthen those hand muscles. Another thing you can do is farmer's walks. If you walk sort of 50 to 100 foot, holding dumbbells at the side of the body with the palms facing inwards, this will help improve endurance and also that grip strength. Holding dumbbells in an underhand grip, keeping the forearm on the thigh, and allow the dumbbell to lower over the knee with a wrist, with the wrist relaxed, and then lifting the dumbbell back as high as possible, not moving the forearm. That can also just help maintain the strength of, the muscles around the wrist. So yeah, it's really just a case of, a lot of it is just pain relief, ice, which is your common sense, and then just supporting that wrist. Common sense, maybe sort of do a lower impact exercise, but then just make sure that you're supporting that joint when you go back into your normal sports or work routine. And as I say, you sort of sports massage can also help, or deep tissue massage to the forearm can also be, quite beneficial. So that's really it on carpal tunnel. As always, feel free to comment down below or contact me through my Facebook and Instagram with any queries, and I will answer you. But for now, that's all from me. So I will see you next time. Bye.